Hi, and welcome to this video about the core competencies for State Flex Program Excellence. My name is Tracy Borden, and I'm joined today by Caleb Syme. We're both representing the National Rural Health Resource Center. The National Rural Health Resource Center is a nonprofit organization that's dedicated to sustaining and improving healthcare in rural America. We're the nation's leading knowledge and technical assistance center about rural health, and our work focuses on the 5 core areas that you can see on your screen. Caleb and I both represent the Technical Assistance and Services Center, or TASC, which is a federally funded program that works with 45 states around the country. TASC is federally funded through the Health Resources and Services Administration Federal Office of Rural Health Policy, or FRHP. And together we provide services, technical information, knowledge, and support to 45 states that participate in the Medicare Rural Hospital Flexibility Program, or FLEX program. That FLEX program runs the country, supports over 1,300 critical access hospitals. The FLEX program is very broad. The work within the FLEX program concentrates on supporting quality improvement, operational and financial improvement, population health, emergency medical services integration, innovation into future models of care, and also supporting the regulations and rules that help critical access hospitals receive that designation and also maintain that designation. So the work of the FLEX program is incredibly broad, and the resource that Caleb and I will be sharing with you today will help state FLEX programs achieve and maintain excellence.
In 2015, a group of experienced State Office of Rural Health Directors, FLEX program coordinators, as well as staff from the Federal Office of Rural Health Policy, FLEX monitoring team, and the Technical Assistance and Services Center, TASC, gathered for a program leadership summit to develop a framework of FLEX program core competencies and recommendations to achieve excellence in state FLEX programs. The summit focused on identifying, discussing, and prioritizing the resources, tools, and training needed to enhance FLEX programs' understanding of strategies for improving rural hospital financial and quality performance, population health, as well as value-based payment models. Summit participants identified the key competencies and described best practices from their experience, as well as tools and resources available or that need to be developed to support the core competencies. The core competencies you can see are listed there below. They were identified by a group of your peers as State FLEX program coordinators. It allows multiple pathways for creating a well-rooted FLEX program, and it's able to withstand programmatic and policy shifts, as well as staff turnover. Content with depth, accessible for any program to work on, allowing for growth. The assessment that we'll discuss later helps identify which areas you might want to start with and focus on first.
So Caleb and I are going to go through each of the 9 core competencies in a little bit more detail. So managing the FLEX program is the first core competency we wanted to discuss, and program management is really at the foundation of a successful program. All the remainders of the core competencies aren't presented in any sort of hierarchical order, but a strong program is really dependent on strong program planning, operations, and the ability to demonstrate your success. So in each of the subsequent slides that we'll share, the core competency is listed at the top of your screen in the blue bar, kind of in the bolded letters. And then there are proficiencies that relate to each of the competencies that the summit participants identified that are then listed below, and we'll describe each of those a little further. So just similar to how we would expect our hospitals to manage their finances, care for their patients, and monitor their outcomes, your program, your FLEX program, should be seeking sound management practices, caring for its delivered activities, monitoring its finances, and monitoring its outcomes as well. There's lots of examples of how programs do this, and no 2 programs do it alike. The core competencies guide provides the proficiencies for you to think about having a sound program to manage.
Building and sustaining partnerships, communication and collaboration with key partner organizations, quality improvement organizations, networks, hospital associations, regional CMS reps, EMS organizations, various offices within the state, Office of Rural Health, as well as many other organizations. Building and sustaining partnerships helps demonstrate to critical access hospitals that you are part of the network of organizations who are available to assist and provide support. Partnerships lead to more informed and involved stakeholders, ultimately increasing program impact, outcomes, and support. The National Flex program has evolved because of the partnerships established and maintained within communities, networks, states, regions, and nationally. As the healthcare system changes, it is imperative that state flex programs have the skills, capacity, and commitment to build and sustain partnerships, new and old, in order to support the critical access hospitals and the National Flex program.
Improving processes and efficiencies is the next core competency to discuss. And you wouldn't expect your doctor's office to be providing your annual exam in the exact same way that they delivered it 5 or 10 years ago. Sure, there are some theories and some concepts that are really timeless, but we're constantly discovering fresh ideas, new medical technologies, and identifying ways to streamline our practices. Improving processes and efficiencies is also important for the Flex program, and these processes and efficiencies could be internal or external to your program. Some programs apply a framework like Plan, Do, Study, Act, or PDSA, or use Lean. Others use techniques like customer feedback and event debriefs and evaluations to address hiccups that might happen along a process or a pathway, or also to just identify new ways to improve and innovate. It's really important to talk to your hospitals as well as your key stakeholders and partners, as well as your subcontractors to your Flex program, to see what they need and see what innovations and ideas they bring to the table. Include them in your planning. It's important to seek out lessons learned and best practices from your peers, your partners, and the hospitals in your state. And you should share your experiences broadly. One of the things that we talk about very frequently within the Flex program is that although no Flex program is alike, it's very important to not reinvent the wheel. It's time not well spent by anyone. So please share your experiences broadly. Others can learn from it and manipulate what you've done to fit their needs. It's important to participate in continuous or lifelong learning, and improving in processes and efficiencies can aid in that. Policies and regulations can be complicated, and understanding those policies and regulations is the next core competency. They can be complicated, but they can also be fascinating. And as in all competencies, you yourself do not need to be the subject matter expert in all areas. But it's important for your program to have a go-to resource for each competency, be that resource on your staff, internal to your organization, or with a partner or a subcontractor. The policies and regulations that you need to understand are both at the state and federal level. A state Flex program should be able to support their hospitals on a grassroots level and assess the impact for them about policies and regulations. The hospitals may also need help with interpreting the impact of the policies and regulations on their organizations. So again, it's important to be able to understand the policies and regulations that are out there, anticipate changes that might be coming, and help the hospitals to deal with them effectively and efficiently.
Promoting quality reporting and improvement. Quality reporting and improvement are priorities of the Centers for Medicare and Medicaid Services. Quality strategy, better health, better care, and lower costs through improvement. The National Flex program is in alignment with these goals and has identified quality improvement as one of its program areas. In order to build program plans and support critical access hospitals in their quality improvement efforts, Flex programs need to be aware of the various quality reporting initiatives and requirements, in particular, the Medicare Beneficiary Quality Improvement Project, or MBQIP, as well as Hospital Compare. Thorough communications with critical access hospitals, through communications with critical access hospitals and by using MBQIP as well as Flex monitoring team data, and reports, state Flex programs can develop a thorough understanding of critical access hospital performance improvements or quality improvement initiatives, including needs and successes. Supporting hospital financial performance. Critical access hospital financial and operational improvement is one of the primary goals of the Flex program. The importance of finances cannot be overstated in relation to the stability of a hospital. Sustainable financial performance of critical access hospitals is essential for both the day-to-day operation of the facility as well as needed investments in technology and infrastructure. Understanding critical access hospital finance is vital for understanding the issues these hospitals are facing and how you can help support them.
Addressing community health needs. Healthcare services provided by a critical access hospital are intended to meet the health needs of their communities. And for the majority, community health improvement is part of their mission. It's likely part of the mission of your state flex programs office as well. So this is a concept that is likely not foreign to many of the state flex programs. Health needs of a community can be identified from a variety of factors, and flex programs can use data to draw connections about the identified needs to what the hospitals are focusing on. This can also help inform the flex program's activities to identify the gaps and then develop the activities to fill those gaps and needs. Moreover, it's important for state flex programs to understand the community needs of their CHs, to leverage program activities in support of health system development, population health improvement, and ultimately improve community wellness.
Understanding systems of care. Given the goals and role of the FLEX program, it is imperative that state FLEX programs understand the healthcare system as a whole, to participate in discussions and planning, and to serve as a rural voice to ensure rural community needs are considered, represented and understood. The better a FLEX program understands the complexity of the issues facing rural providers, the better a FLEX program is prepared to support the efforts needed to address the unique issues in each community.
So Caleb and I there just did a quick overview of the various different core competencies. And what we'd like to do now is share with you where you can find the resources on the Technical Assistance and Services Center webpage, including the guide, a webpage of resources to support the competencies and deepening your understanding within them, as well as a self-assessment that your organization can take. So I'm going to share my screen now and help you navigate to where you can find these items. So what I'm sharing is the main landing page for the National Rural Health Resource Center, which is ruralcenter.org. From this site, you would go to Programs and then click on the link for Task. On the main task landing page, it's really simple to get to the core competencies. Over here in the blue column on the right, their core competencies page is just linked right there. So if I click on that, what it does is bring me to an overview page describing some of the things that Caleb and I shared in this video about how it was developed and what the background information is. If I scroll down a little bit farther, you can see the link to the guide, a link to a video like this explaining what the guides is and what the assessments are, as well as the link to complete the core competency assessment itself. Further down, there's information related to each of the core competencies, and I'll share that with you here in just a minute. But what I'd like to first share is what the guide looks like. So to open the guide, you could simply click on this link here. I've already downloaded and opened it, so I'd like to share with you what it looked like. This guide is updated frequently within our organization, making sure that the content within here is still relevant with the times and that the resources that are linked within here are still really the best nuts and bolts resources to kind of get you going with understanding how to improve the depth of your FLEX program. So at the beginning, there's an overview of how the program was and this project was developed, like Caleb described earlier. And then links to some of the tools, but what I wanted to show you was how each of the core competencies is explained. So we started at the beginning of our video today talking about managing the FLEX program. So that core competency is listed here and a little bit of background description about why it's important, as well as the various proficiencies that are related to that core competency are listed below. And then scrolling down farther, you can see that managing the grant is the first proficiency that's listed. And then down below, there's a description more about managing the grant and some insight to help you further your understanding within that particular area. At the end of this document, and part of the content that is updated annually, is an appendix of resource. And I apologize for scrolling fast here. but there's an appendix of resources that are related to each of the core competencies. So the appendix at first just gives some background information and links to resources about what the FLEX program is. But further down, you can see here under managing the FLEX program, et cetera, there are hyperlinks, some of our best of the best resources to really help you dive into that topic further. And then so on and so forth, it continues for each of the subsequent core competencies. So that's a little bit about what the guide looks like. And if I go back to the main page here, again, it's linked right there. On the menu bar on the right, I can also find each of those core competencies listed. So again, if I would click on, say, building and sustaining partnerships, I come to a page that provides some background information, bullets about what the proficiencies are, and then a resource library below that's been curated specifically about building and sustaining partnerships, that area. I can do a word search up here if I'm interested in something that maybe would be related to this topic, to see if there are further resources that maybe help me improve my understanding about subcontracts, which maybe wasn't a good fit for this one, but something in my drop-down list. So you can just see that there's the ability to search in the resource pool there. And clicking back here then to the main core competencies page, I want to share with you information about the self-assessment. So the link to complete the self-assessment is here, and first a little bit of background information. So first and foremost, the self-assessment is not about any one individual. It's about the competencies of your program in its entirety. And that includes the internal staff to your organization that you have supporting the FLEX program, as well as other bureaus and departments that you might rely on that maybe aren't so FTE that are supported by the cooperative agreement or grant, but are those that you rely on, say maybe your EMS bureau. The competencies also reflect the resource network that you have outside of your organization, be that through other key stakeholders or partners, as well as subcontractors too. So this self-assessment is never actually meant to assess the competencies of one individual, because we realize that a FLEX program is really supported by so many people within a state because of the breadth of content that it covers, and then sometimes really the depth within particular topic areas as well. So we strongly encourage you to not take this assessment as one sole person because it was not designed to do that, but to sit down with the team to do that. We also encourage you to take this assessment at least annually. If your program is new or you've had massive turnover within your program or within your stakeholders or subcontractors, it's a great time to take the self-assessment. And it can provide you with a baseline understanding of where your program is at that time. There are also particular times of the year that if you're participating in a project with tasks that we might ask you to take the assessment. An example of that would be when you're coming to attend a FLEX program workshop, be it virtual or in person, or if you're participating in a state technical consultation project with us. This provides some understanding for both participating groups about where your program is at within the various core competencies. When you take the assessment, the results come into a database that's behind the scenes on our website. So TASC, of course, sees the results, and we will reach out to you to offer one-on-one technical support to help you improve your performance in any of the areas. FRHP does not receive an example of the scores. They may be engaged at particular times if they are participating in a project with your organization, but we don't automatically just share the scores with them, and they are not meant to be punitive in any shape of the imagination, nor are they ever used to hold against you or hold you accountable for any funding. So please do know that as well. It's really meant as a resource to kind of boost your program along the way, recognizing that all programs are continuously growing and expanding. So I wanted to share a little bit about what the assessment looks like when you complete it, and it's down here below. So you will see within each of the different core competencies, a rectangle that looks like this, where it has the competency in bold, and then the proficiencies listed below there, where you as your team then would score yourself, ranging from highly competent to little or no competence on a Likert scale. And then down below is an opportunity for you to provide some notes, more for yourself, about where those proficiencies lie. Is it within a particular staff person or a particular department, or is it a key stakeholder that really holds that expertise for your program? So on and so forth, it goes down through the 9 competencies. And at the bottom is the opportunity then for you to select, if you'd like some technical assistance, what state you're representing your organization, who you are, and your email. And your email, of course, is particularly important for you to be able to see the results. So when you hit submit, like I said before, it goes into a database that's along with our website, and we get a notification as well as you will, and receive an email that'll have a hyperlink to be able to view your scores. And to share with you what your scores look like, I wanted to share an example. So you will get a hyperlink to a resource then that suggests you click on it, which will give you some information. And we really suggest that you pay attention to any of the scores that are at moderately competent, a 3 or below, as areas to continue to improve your understanding. So, and you will see a score like that looks like this. The top possible score is a 45, and then your organization score will be listed there. And then to share with you what it looks like for a particular area, going down here, say to improving processes and efficiencies, you can see each of the scores that were entered for a particular proficiency within that competency, and then an average of that number. And then any notes that you may have put in when you completed your assessment about where the expertise for that particular competency lies. So again, TASC will reach out to you to offer any technical assistance that you might need with that, and to help you improve, as well as to suggest resources to, and we're always open for conversation about how to move the dial for your organization. So that's a little bit about where those resources lie that you can use to access, to assess the competencies for your organization, to build understanding. And the Core Competencies Guide is a great foundational tool for when staff are new to your organization. So if you have any questions, we really want you to reach out to TASC. We're more than happy to answer any questions or point you in the right direction to any tools, resources, or other subject matter experts. Our phone number is there on the screen for you, as well as our email address, and we welcome your feedback. Thank you so much for your time today, and we look forward to hearing from you.
Thanks, guys.